please follow the additional guidelines recommended by health authorities like WHO and local health authorities. This message is brought to you in the interest of public health by Hygienix Liquid Soap, Hygienix Hygiene Soap, and Hygienix Instant Hand Sanitizer.
It's a pandemic that has left major cities of the world, busy trading centers locked down. Big cities such as New York, one of the cities in the world that's tempted to be a city that doesn't go to sleep. But because of this global pandemic, New York City is under lockdown. In fact, the United States of America has ordered that one among its 5 citizens must not be allowed to walk out of a vicinity. So it's all in an effort to try and mitigate on the spread of COVID-19, which has claimed over 10,000 lives globally to date and over 250,000 infected persons. My name is Samuel Machishi. Thank you for joining us for this live update. My sign language interpreter in the studio is Chola Kaoma. Chileshe Kangwa, our staffer, is already at the headquarters of the Ministry of Health in Zambia. Ndeke House will be getting to her to just find out how they're trying to settle down there in anticipation for this update. We know that since Saturday last week, the Ministry of Health, or the government of the Republic of Zambia through the Ministry of Health, has been giving updates to the nation from the Ndeke House. Yes, another recap on those figures: over 250,000 infected by the coronavirus globally, over 10,000 recorded to have died this far, and about 4 countries have gone past 1,000 in terms of the country death toll. Yes, China, thousands of people there have died. Italy has passed the record 1,000. Iran, the same is the case, has gone beyond 1,000 in terms of deaths. But globally, it stands at over 10,000 people dead. Africa is not remaining behind. A lot of efforts are being made to make sure that citizens are prevented from getting this COVID-19. At country level, a lot has happened since Thursday when we came live to give an update through ZNBC TV1. Various ministries, line ministries. Yesterday, the Ministry of Tourism through the Minister Ronald Chitotela did give an indication as regards how the tourism sector has been affected. Some people that had made reservations to come into the country have had to cancel some of these reservations, and some of them are claiming they should be refunded of some of the deposits they had made towards their stay in the country at various tourism sites. Not only that, the Minister of Local Government, we were with him a little earlier today on Kwacha Good Morning Zambia, where he mentioned some of the strides being made by his ministry to make sure that members of the public are kept abreast with the new trends in terms of handling food, how you greet, how you shake hands with people. In fact, shaking hands, well, it's been mentioned that we should do away with handshakes and replace it by maybe just saying a high five there. At least it's going to help us not to spread the COVID-19. At a country level, still 2 cases are being spoken about, that which was given to us as an indicator on Wednesday during that live broadcast of the briefing. The Minister of Health did mention 2 cases under quarantine still now. And as we speak, another report that we got this morning from the Zambia National Public Health Institute Director, Professor Dr. Victor Mukonka, he did mention on Kwacha Good Morning Zambia that the family members, the children to the 2, mother and father, who were gotten positive, did indicate that the children have been released to go home after having been seriously scrutinized. And as it is, they are still under observation. A lot of over 30,000 people have been scrutinized in Zambia alone since COVID-19 was reported and the measures were brought into effect. So a lot is expected from today's briefing. Stay tuned to ZNBC TV1 to get an update at a country scenario so that we know exactly what is happening. What is the latest regarding the 2 who tested positive and how are the surveillance systems going on. A little earlier, monitoring the news via ZNBC is that the University Teaching Hospital voluntarily, some people have passed through there to just go and have themselves checked. And that's the encouragement to all of us that if you do not feel well, the best is to visit any health institution, especially those that are designated for this particular purpose, to try and ascertain whether you're positive or not, especially those that have a history in recent past of having traveled out of the country. So stay with us. We will be giving you a lot more information regarding there. The toll-free line has been set aside, 909. 909. That's the toll-free line you can call from any part of the country. Officials should be able to pick up, and we have been told this morning that indeed that number has gotten busy, people trying to inquire one or two things about the COVID-19. Let's keep it that way. Alternatively, there have been other numbers that have kept scrolling below our screen as NBC TV1 to try and let you know where you can get the assistance from. So Chilesha Kangwa is standing by for us, still at the Ndeke House, Minister of Health headquarters. We will be getting to her just so we can find out how they're having to settle down, and just maybe if the ministers could already be there. Now, in Africa, in Africa, countries such as Egypt, followed by South Africa, those are the leading in terms of cases, but the situation is really under control, and we've been told that no need to panic. For now, let's just take you through certain trading areas where our reporter Sokolo Sichula has been to just check on how people are responding, especially at bus stations where we're having to board or disembark from buses. Here is in Sokolo for us.
It is a disease that has the world at a standstill. The coronavirus, or COVID-19, continues to be a public health concern in many countries. Zambia recently recorded 2 cases of the coronavirus. No panic is the message for the general public. Screening process is now mandatory and more rigorous to keep the virus at bay. With the SI21 and SI22 of 2020 being affected, the highest levels of hygiene are to be observed. Kwacha Good Morning Zambia did a random survey to see how market traders are faring in the wake of the coronavirus. Hand wash is advised as a standard practice in the fight against the spread of the virus. Is the message clear?
Natukwata chlorine yo tule bonfya kumenshi aya kusamba kuminwe then tule bonfya na hand wash na sanitizer kwa bati tuma James tule tutalukako then tule fa kwa na cleaning ne sopo tule bombera tufiro kukwata obusaka.
Here in the market, like at our shop, we've got a bucket of water, and we've put some washing hand wash, so that we can. We are telling people when they are coming in the shop to wash their hands before they enter the shop.
Tifunika pameta nkhala tizing pyanga pazinkhala clean pazinkhala doti. So singa matenda ajasenga tifike ngati panti nkhala pakhala clean tipyanga sianga fike kuli ife matenda amene aya.
For the Chilenja market chairperson, the market has a daily routine of sensitization to create an earworm for the market traders.
Since the corona outbreaks broke out, we have been working together with health officials to sensitize our marketeers on to maintain total hygiene so that our market can be maintained under cleanliness. So also we are also urging our traders and our marketeers to have hand washing basins at their stands and shops to stop the outbreak of coronavirus in our market and in our community at large. So we are also working together, make sure that garbage collections are collected on time, so that our market can remain. We don't want to record any outbreak of coronavirus.
The upscaling of hygiene standards in the market has made it easy for customers to understand the gravity of the threat of the coronavirus. In Kalingalinga Market, the situation is similar. Market traders here are hard at work ensuring that the Keep Zambia Clean, Green and Healthy campaign is a reality. The team took a step further and visited a strawberry farm in Makeni. As producers, they too have a responsibility to maintain high standards of hygiene.
Balisaranda muchina muchinko kwebati lyonse lyawabuka ufiri tashani wasamba kuminwe na sopo wasamba kuminwe na sopo na pafia kulia ponse mule ifunika papa kwebati nangola inishoti ubusaka nani pakwebati tetimute nani musenda malwele oro mulenge abantu bamowa bakaele balwalilema mukwaye.
Coronavirus ndiye amene wanatiuza mwamene mabwerera mwamene tingauzire ko banzatu baje bali mufupi na ise kuti coronavirus niyo ipa mabwera so tifuni ko chitaso tifuni unkala so ndiye vamene tinawaponzisira mwanga mwamene wanatiuzira na ise mweti ziwira.
Public health remains an issue of the highest concern. Correct information and hygiene practices can save lives.
Restrictions on public gatherings have been put in place to avoid any further spread of the COVID-19. Nsokolo Sichula reporting in Lusaka.
Stringent measures being put in place at a local scene in Zambia to make sure that COVID-19 doesn't get to spread around the citizens. Sokolo Sichula there. Now, some of the points we want to recap on that have come through these updates, such as the one we're expecting just in the next few minutes, is that visitations to hospitals, detention centers, correctional facilities have been restricted. When we talk about hospitals, we know that in Zambia, for example, the University Teaching Hospital, around 06 hours to 7 hours, there's an hour dedicated to visitors to visit their sick relatives admitted to hospital. And in the afternoon, it is from 17 hours to somewhere around 18 hours. So that hour has been restricted, and only one bedsider is being allowed by the bedside. Detention centers, a little earlier we were with the Zambia police spokesperson, Esther Katongo, who mentions that detention centers under the police service, for example, remand prisons, we could say, have been restricted. Visitations there also are being restricted. Also from the correctional facilities, the Zambia Prison Service, if you would like to recall through that name, are being restricted also. And also restricted schools, which now have officially closed on the 20th of March 2020 on Friday, and pupils, students have all been sent home. So these are some of the measures that are being put in place at a local scale to make sure that everything remains stable. Don't panic is the message being communicated. Let's catch up with Chileshe now at Ndeke House. Chileshe, just tell us what's currently happening there.
So much, Sam. Today is the 5th of the addresses that we have been seeing in as far as the COVID-19 is concerned. And as you can see in your picture, media houses are already set up and ready to get what is to be said today. And yesterday we did have another briefing at the Ministry of Information and Broadcasting Services. And we did have the Minister of Tourism as well as the Minister of Local Government. And what they were talking about was how the coronavirus has affected their various ministries. Most importantly, we have seen the rolling out of the cleaning up of the markets, and we did have that interview today with the Minister of Local Government, Charles Banda, and we were privy to information that this will be an ongoing exercise, but it will be taking place also across the country, so people should not think it's a Lusaka thing. It will take place across the country, and right now market traders across the country have been busy cleaning up their areas of operation. And we saw that even with Nsokolo's report, where she did highlight how Chilenge Market is one of those ambassadors that is pushing the message of cleanliness in the marketplaces. Also, the Ministry of Tourism did state that things have become a bit hard, Sam, because the tourism industry cannot flourish with the coronavirus. As we know, transportation has been also highly affected by this virus, and this means tourists will not be coming into Zambia as much. So we have seen that the various ministries have been affected, and this is why it's being called a multi-sectoral approach, because everyone is affected. And we did see here the Minister of Fisheries and Livestock, Professor Nkanduluo, just being a part of the entourage that was here earlier on. We've been here from about 9 hours just to get the right information to the people, and soon we will see the Minister of Health address the people. But various sectors
what is the story going around,
hard.
Shilesho, with regards to trading? I know there should be some more clarifications that's going to be given. We were on Kwacha Good Morning Zambia with Dr. Charles Banda, the Minister of Local Government, who says trading will go on in the markets as cleaning intensifies, but then again, there's not going to be street vending is being discouraged. Do we see a stamp on the feet, like with vigor, and any measures that could be brought in place to make sure that street vendors, just in case they're on the streets, they are gotten rid of? Are they going to be told to move out? What's the word on the ground?
Yes, Sam, like we were told this morning that Lumumba Road has been designated for those vending on the streets. Anyone found elsewhere will actually be penalized. So we will see that street vending will go down. And like you know, Sam, and our viewers know, sometimes street vending is an avenue for solid waste. And this, if not managed, can be a breeding ground for any virus, not just the coronavirus. And that's what we want to see, clean streets. So street vending is not being encouraged. And I do know that the police and the council police themselves will be up and about on the streets of Lusaka and across the country just to ensure that we do not see street vending and that the highest levels of cleanliness are upheld. So that is what is happening, and as far as the street vending is concerned. One issue also that comes up, and something that we have to get used to, is the face mask. I don't know how many people you could have seen wear these, but we've seen a lot of people devise mechanisms. If they don't have a professional one done like this one, then they'll probably make. Okay, Sam, when it comes to the issue of the face masks, we have seen that it is being applied. Just earlier on today, we did see that some filling stations or service stations are having their attendants wear the gloves and the face masks. I know that there has been concern that the prices have gone up, but a lot of people, especially after the 2 cases were announced, we have seen that more people are buying the face masks. But remember that it's not just about wearing the face masks or the gloves, but it's about hand hygiene. It's also about using your bent elbow when you cough, use your handkerchief, and all those things that will help stop the spread of the virus. Right now, we just have 2 cases, and that is what we want to do to keep these cases at bay. As you heard this morning, the 2 individuals are getting better, and we hopefully will hear that they'll be integrated back into society soon. But what we see is that people are purchasing the masks, and even some of the journalists yesterday during our press briefing at the Ministry of Information did wear those masks, and the minister actually commended the journalists because, as you know, we are in the front line and we are at risk, but the information needs to go out. So we are also upholding the highest standards of cleanliness.
I know you do have enough space to do a demonstration. When they say cough in your elbow, somebody could be thinking you cough from this end. How is it done?
So it's a bent elbow cough, and I know that social media is actually calling it dub when you cough. It's almost like this. So when you bend your elbow, you actually cough into it. And earlier on, I know Professor Mukonka actually showed us how to do it. So it will help stop the spread. So you're not really coughing into your hands, because your hands are the avenue of spreading the virus. Remember that surfaces, we continue to touch doorknobs, we continue to touch our tables, even at work, our laptops. Earlier on, we did hear from the Zambia National Building Society, who were talking about actually disinfecting ATM machines. And these are things that we do every day unconsciously, but we do know that they can be an avenue for the spread of diseases. So we will see a lot of things being put in place. And Sam, just to take you back to last week and a few days ago, the Road Transport and Safety Agency did announce that people should not panic when it comes to road taxes. They do not want congestion in their offices, and there has been an extension, and we will see this happening even in our banking halls and all the these service providers, people are being told to come in smaller numbers because the spread can be paramount, especially if we are overcrowded. So that's what we will be seeing in the coming days, less people in these areas, in the banking halls, and we're being encouraged to use our phones, our laptops, just to utilize the internet for good now for your transactions. If you're about to buy maybe your Zesco units, use your telephone, your cell phone, or if you want to pay for your water bill, you can use your cell phone. But we did hear also from the Minister of Water that no one will have their water disconnected during this time. As you know, water is life, and we're going to World Water Day. What a gift for the community.
It will be important to know how families are getting to react in terms of keeping a distance from each member of the family, 1 meter if you can afford. If the emphasis is let's try as much as we can not to have direct contact with the next person next to us, how do you think families can be able to overcome that? It's a tradition that every day we live with.
Yes, Sam, at family level, and this has been encouraged, and you have heard from the ministers, the different ministers, that this is concerted effort. So no one should think that the coronavirus is too far from them, because it can be close to home. For some of us who go out to work, you may get it and take it home. We do have our house helps that come from different places, but what we're encouraging, Sam, is that we will not stigmatize, but we will encourage hand wash, constant hand wash. And I think families have been ahead in as far as getting the information to their children. Earlier on in the week, we did hear that the Minister of Education was talking about children actually telling you that you can't shake my hand because of this virus. And I think a lot of children have been glued to their television sets in as far as getting information is concerned. So we do know that at family level, highest hygiene practices have to be upheld. When you're going out of the house, come back, wash your hands, make sure that your hands are clean all the time. And if you display any flu symptoms, we want you to actually go to the hospital and just be in the clear. 2 SIs have been put in place, and this is very important that we take the lead as people, especially in our communities, even just spreading the word on the coronavirus. Some people will ask you, Sam, is COVID-19 and the coronavirus the same thing? And I've got that question a lot of times, and that is where you come in when it comes to sensitization, to just tell people what is really happening and what is on the ground. So at family level, there is a big responsibility, and it's just nice to see how the communities are actually reacting to this pandemic, and how they are awake to the fact that it is real, it is close to home, it is around, and that we have to prevent it.
Thank you so much, Lisha. Do stay with us just in the background. We will be getting back to you because we know the ministers could be.
Thank you, Sam. Thank you.
So thank you so much indeed. You're watching the live update of the COVID-19 at the country level. The Minister of Health, as usual, leading a team of ministers, are expected to make another briefing to the nation. So don't you go away. Stay with ZNBC TV1, your public service broadcaster. Yes, the sensitizations should still continue, because it's a disease that has got the attention of the entire world. The World Health Organization, WHO, has emphasized and declared it a global pandemic. It's a disease that has seen over 10,000 lives, claimed over 10,000 lives, over 250,000 people tested positive, and thousands, we can say again, have been released and have gone back home healed. But it's something that calls for concerted efforts, governments all around the world, stakeholders, as well as at an individual level. In Africa, notable measures that have been put in place is the halting of some flights into other countries. For example, South African Airways has suspended flights, international flights, for up until May. And so is the same for some of the flights that come into the country. In Zambia, Emirates has suspended flights into Zambia as well. So this is to try and minimize on contact with people that are coming from outside the country, especially from high-risk countries. So those are some of the measures that are being put in place. The remarkable thing to note yet again is that China, where the first cases of the coronavirus were reported in Wuhan city, has not recorded a case locally from within itself for 2 days in a row. the cases they're having to report as positive now, as in new cases, imported cases, meaning they're having to come outside of China into China, and some of those are being tested positive to COVID-19. But China itself has managed to contain the situation to that much for now, 2 days in a row without recording a case locally. Quite an achievement, we can say, for now. And we keep looking at how the world scenario keeps, dealing with this scenario. But country level, very essential as well, because it's about us getting involved also to be part of the solution. Most of the countries, yet again, globally are making sure that the only people that get to return into the country are their nationals. Those that are coming from outside, for example, in South Africa, the Minister of Transport, Fikile Mbalula, the other day was addressing the nation. Also, the measure that they've put in place is that if a flight is coming from outside of South Africa, going into South Africa, only its nationals will disembark, and then will have to be quarantined for 14 days or beyond just to make sure they are okay. If they are not South African nationals, they will have to go back with that plane. Some of those measures are put in place. Let's take a break. When we do return, we'll be giving you much more information about COVID-19. But now let's take you to one issue that social media picked wrongly during that address, where they thought 2 hours of bars operating only, and social media was awash with this one, except now we have the correct position. The position is that bars, which normally close at 22 hours under normal operation, they are to reduce by 2 hours. So under normal circumstances, bars in Zambia operate from 10 hours to 22 hours, but are to reduce by 2 hours. So if you do your math correctly, then it brings us back to 20 hours. Will they adhere to that? That's one thing that we want to follow up. Let's take you to this piece. As we return, we have more information.
Social distancing, hygiene practices, and early detection are at the core of prevention of the coronavirus. A multi-sectoral approach has been taken in order to enhance these standards in the country. Currently, Zambia has recorded 2 cases of the coronavirus. Line ministries like the Ministry of Local Government are key in the fight. Bars and restaurants where most people spend their time have been advised to reduce on their operating hours. In Kalingalinga, Peter Daka, a bar owner, shared how he is ensuring that clients are aware of the use of the sanitizers. He says his type of business is critical in the prevention process.
It comes through shaking hands, the symptoms are sneezing, coughing, so we need to protect our mouth before we go for a test. We even give it to my challenge, to my mouth challenge.
Local restaurants have been growing in popularity over the years. Many people spend time in these restaurants having a meal. This is why restaurant owners are sensitizing the workforce and clients as they visit their operational areas.
Nakuisa coronavirus, so pomule sangwa ponse pare moneka klini, komule spira mambare klini. Namo murerira abantu pamatebo, mwakusana pusana mambare. Mwa kusambira abantu furena mwa abantu basamba, mafumia ko mwaitira menshi mwasukamo. Yafine muma shopu yafine mure pyangamo
anatuza tibwera kimonga kuchimfine kuchimfuba so pamini muliri pafunika konkala clean lero timayozingisa ko jasafu janga twangena mkati bafunika kusamba kumanja lero na kukosomola bafunika kukosomolera apa na kitiche mulira apa kulibe kuposha na kumanja lero pamini musebenzera pafunika konkala clean mambale afuni konkala clean kali konse chapi afuni konkala clean idhani state zako matenda ya chani ya virus.
Public transport is at the heart of the economy. The wheels that drive the economy are key in the fight against coronavirus. Bus owners are ensuring that the correct personal protective equipment, PPE, is delivered to the operators.
Sanitizer so that the passenger then
we are given this to prevent the disease which have coming out. All drivers have been given sanitizer to put on their hands to give drivers, conductors, to also to prevent, but we are lacking to our families, we are not given. So we don't know how are we going to prevent to our families.
For prevention.
The coronavirus has been described as a public health emergency. The onus is on the community to cooperate and ensure the best hygiene practices. Michael Chapa, ZNBC TV1.
Michael Chapa with that report indicating that most of the bar owners really want to comply because it's lives at stake here. Business could come number one, but only if citizens who are supposed to be your clients are in good health as well. So if, they say tough times call for tough measures, and this is just that time for us to intensify anything that we can do to try and make sure that we are doing the right thing to help the authorities contain COVID-19. We'll be digging up a little bit of some facts regarding COVID-19. It's a virus that broke out in Wuhan province in China in early to mid-December 2019. Getting into 2020, it had intensified and thousands had been infected. We know that there was a lockdown of Wuhan province to the rest of the world and to the rest of China. Most of the students were stranded in there, but we saw that slowly but surely the situation has kind of improved in the whole of China. And now the epicenter of the COVID-19, of the coronavirus, is being said to be Italy in Europe, where thousands now have been infected and also over 1,000 have lost their lives. Elsewhere in Iran, Iran has been hit hard as well. And notable people who had been tested positive. We know actor Idris Elba of United Kingdom, a British nationality there, had it, and he came out in the open and called everyone to be vigilant. And it's a serious illness. We want to take it as serious as it is. And also the wife of Canadian Prime Minister Justin Trudeau also tested positive to COVID-19. So really it knows no race, because those were some of the social media myths and misconceptions that were being peddled by some people that COVID-19 does not attack certain races. But now we are aware it attacks every race. So it doesn't choose any race. It doesn't have a particular age, though again social media was awash saying that only those above 60s are susceptible to this particular virus. It is not true. Any person is capable of contracting the COVID-19. Now, it's a flu, something that most of the health professionals are saying really it's just like a common flu, but except it has a certain element that makes it more complicated than the usual flus that we get to have sometimes. So it gives difficult in breathing. Somebody may have some difficulties in breathing. You tend to have a cough, and one of the ways that we've been asked to frequently do is wash our hands time and again, avoid handshakes, do sanitize your hands, and take warm fluids at several intervals during the day. So we want to make sure that we get to do all these precautions that we are being told. Also have a mask if you can get yourself one from any local store nearby, wherever you could be. So stay tuned. ZNBC TV1 is giving you this particular update as and when it is needed, especially when we have a ministerial statement coming from Deke House, the headquarters of the Ministry of Health in Zambia, where anytime soon we will be going back there as the Minister of Health, Dr. Chitalu Chilufya, accompanied by other ministers we know, because this is calling for a multi-sectoral approach. They'll certainly take to media and address the nation and give an update. And most of the people are looking forward to an update regarding the two that tested positive, a couple and their two children who had been to France for 10 days on a holiday. They returned to Zambia on the 15th of March 2020, and upon returning, they were quarantined and they were able to be observed for now, and their children have tested negative. Let's take a breather. We will certainly be back with you.
Coronavirus, what you need to know.
What is it?
It is a pneumonia-like infection, possibly originated in animals and spread to humans. It causes illness ranging from the common cold to more severe diseases.
How does it spread?
It is transmitted from human to human and is airborne. It spreads through respiratory droplets when an infected person coughs or sneezes.
How can I protect myself and others?
Wash hands thoroughly with soap and water or an alcohol-based hand rub. Cover nose and mouth when coughing and sneezing. Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching eyes, nose, and mouth. Cook meat and eggs thoroughly. Avoid unprotected contact with live, wild, or farm animals. Avoid non-essential travel, especially if you have a fever or cough.
What are the signs and symptoms?
Fever, a headache, coughs, sneezing, shortness of breath, sore throat, chest pains, rapid heartbeat, breathing difficulty. In severe cases, it also causes pneumonia and even death.
What should I do if I think I am infected?
If you present any of the above symptoms, seek medical care and share previous travel history with medical personnel. For further information, contact the Ministry of Health 0211253040 up to 5 or the Zambia National Public Health Institute 0211269432 0964638726 09744935553 or 0953898941.
Lero tikumbula tiboni zona.
Ntawo yosamba kumanja kulibe.
Hygienic Police.
Imwe kuti samba kumanja. Bada chain malpractice.
Apa nomba diarrhea. Yala mixta assault pamala.
That's why mfunko sambira na hygienic soap. Officer Pompi.
Go please, madam.
Go and hygienics and kurukuta them.
Hygienic soap with active silver technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
You are live on ZNBC TV1. We expect to cross back to Ndeke House, where Chile Shekangwa is standing by for us with the Minister of Health, Dr. Chitalu Chilufya, who is going to give an update on the COVID-19 at country level. It's a situation that calls for everyone to get involved, like we mentioned. And we've seen a couple of people, well-wishers, donate various items that they're able to donate as companies to this cause, to try and mitigate on the cost that comes with it. Remember, it's about the financial status of the global village that is at stake. So at a personal level, what you need to do, from what we know, is avoid direct contact with people that could have a flu, and also wash hands as often as you can, 20 seconds to the most. At least take 20 seconds in washing. It should be enough to wash it away, just in case you came in contact with a person who has the sickness. And so take warm fluids as well. The doctors are saying visiting a doctor would be very, very paramount. And we know in Zambia, in Lusaka to be specific, there are certain centers that have been set aside for people to voluntarily go there and have themselves checked out. The country's biggest referral center, University Teaching Hospital, is one such hospital that's handling such. We've been given an update regarding the over 400 health personnel that have been trained to handle just in case there's such a case. And also at various provincial hospitals and health centers, there are health personnel that have been specifically given information on how they can respond to a call of a suspected case of COVID-19 at various provincial levels. Professor Dr. Victor Mukonka did speak to us regarding this particular arrangement that's been put in place to make sure that everyone gets to be involved and protected. Unfortunately, from all around the world, thousands of doctors have been caught in the web, and so they are going to ensure that they protect them as well. Now, our newsroom has been on the ground also to try and gather information from all angles. In this particular report, our reporter caught up with the Vice President of the Republic of Zambia, Her Honor Inonge Mutukwawina. Let's just watch this report.
2 days ago, our country recorded 2 cases on COVID-19, therefore bringing the problem right to our doorsteps. This requires immediate concerted effort for us to contain its spread. I'm aware that from the time this pandemic began, the Zambia National Public Health Institute has been closely monitoring the situation. I'm also happy to report that the National Preparedness and the Epidemic Committees and the Technical Committee of Permanent Secretaries on Epidemic Preparedness and Response have been meeting weekly to monitor the pandemic as it evolves.
And secondly, we're taking travel history, and those with history of travel to COVID-19 high-risk countries or transiting through those countries, we're giving them intensified screening. We are further contact tracing anyone who has come into contact with such people.
Republican Vice President Inonge Winner there, and culminated into the Minister of Health, Dr. Chitalu Chilufya. It shows how important multi-sectoral approach to such a problem can yield some positive results. The partners have been to the Ndeke House where these updates have been taking place from, and we know that the United Nations family in Zambia, UN agencies, are also playing a role. We know the WHO country rep has been on the case in Zambia. The CDC under the USAID, US Embassy has also been on the media to just voice their partnership with the Zambian government to fight the pandemic. Kumba Magadio is the country rep for UN in the country, and she said that they are rallying behind the efforts that government is putting up. So indeed, everyone should be in the know of what they are supposed to do and at what time. We mentioned that the University Teaching Hospital has been busy since it was opened up for such an undertaking, and various camps have been set up within the hospital to see to it that those that voluntarily show up are tested. So let's join Penop Sikazwe, who went to the University Teaching Hospital here in Lusaka, and she gathered this detail.
It is a few minutes after 13 hours, and she's one of the clients seen today at the pre-screening center at the University Teaching Hospital. Among the measures that UTH has enforced here to protect everybody against the coronavirus is restriction on visitations to patients here. Now, another thing is the pre-screening center. If you have symptoms, you feel you have symptoms of the coronavirus, this is the first place you come to be handled by professionals.
It has been active since March, and just in the month of March, we've seen about 29 people, that is adults.
Health workers at the receiving end have been equipped with facilities and uniforms that will ensure they are all well taken care of as they care for others.
We have a slogan in this country, leaving no one behind. And so even those ones who are frontliners, the ones who are supposed to be attending to us, just in case you have COVID-19, they are also protected. And so the protective wear for them is there. But the other thing that we would also want to mention, this thing is really sensitive. Let's avoid negative energy. What we need right now is a positive energy, because with positive energy, we work together.
That they are the first line of contact. So they have to be safe even before they attend to the public out there. So they need to familiarize themselves and implement what is in the SI. And we also want to urge them to be ambassadors.
Zambia has not recorded any cases since the first two announced on Wednesday. Penlop Sikazwe, ZNBC News, Lusaka.
Our reporter Penlop Sikazwe, who went to the University Teaching Hospital there, reporting regarding some of the people that went there to have themselves checked. This is maybe after having suspected they came from outside the country and their temperature was more than the usual, and so they decided to go and be checked by the medical personnel, which is being encouraged really. And it is there that we also want to reiterate what has been released as an announcement from the university teaching hospitals and other hospitals around the country, that visitations to hospitals now are under restrictions. Not too many people are being allowed to go and visit their sick loved ones. It may sound a bitter thing that you're not going to have to see your not well relative in hospital, but it's all in good faith, because they're trying to prevent us from getting into contact. After all, a hospital is already a place of high risk to certain infections. So coupled with the coronavirus, we need to take all the precautions that we have to. Away from there, there's been quite a lot that's been talked about when it comes to business and the impact that coronavirus has had. We've seen market centers, global market trends tumble down because of the coronavirus. Let's now take you to a report by Sharon Kunda, who looks at the tourism sector and what has been the impact of the coronavirus on the tourism sector in the country.
The outbreak of the coronavirus has continued affecting the socio-economic and health sectors of various countries. Zambia is one of the countries that is feeling the impact of the pandemic. Ministers of Tourism, Local Government and Information and Broadcasting Services held a joint press briefing to inform the media on the country's situation. The tourism sector has been hard hit by the outbreak, with a reduction in global traffic.
15,000 people have cancelled their travel. Some of the people that have cancelled their travel to Livingstone are demanding for a full repayment of the money. $1,641,791.
Local Government Minister Charles Banda has reiterated that restaurants, markets, bus stations, bars and malls are not closing down.
We are starting to clean markets tomorrow, and this should happen throughout the country. We are not saying that markets will only be cleaned on Saturday and Sunday. What we are going to do is just a launch of the Keep Markets Clean. We need to be in clean environments. And we are not going to close any market at all. That has been the question. When cleaning, are you closing? We are not closing.
Information Minister Dora Silia says measures taken by government are in an effort to protect citizens and the country.
Since yesterday, we have noticed that there have been quite a lot of panic, a lot of rumors circulating on whether Zambia is in a state of emergency, whether there's a curfew, whether there's a lockdown. No, there is none of that, and I think the Minister of Health was very clear yesterday that he'll continue to give us updates, and whenever there are new measures, they will be introduced.
Later, the Information Minister held a briefing with Minister of Mines Richard Musukwa and a delegation from the Chamber of Mines.
During this period of coronavirus, we want to ring-fence the mining operation so that out of this situation we can come out more stronger, more united, and that the issues that divide us are issues of the past, because then we can now focus in terms of ensuring we run and operate a mining industry which is anchored on a fiscal regime agreed with our stakeholders.
Goodwill Mateo is president of the Chamber of Mines.
This is a very important national issue, and to give the assurance that we'll put our heads together and put our best efforts to do this, and we dare not fail.
Journalists have been called on to send correct information that does not negatively affect the economy. Sharon Kunda, ZNBC News, Lusaka.
The impact of the COVID-19, 15,000 people that were destined for Zambia in terms of tourism This could have been destined to go to various parts of the country where they were going to view the beauty of this republic, enjoy the national parks. And they had made some reservations and made some down payments. But then again, they turn around because of the COVID-19, claiming that huge amount mentioned by the minister, $1,647,091 US. That's how much the country stands to lose if it continues to affect us. So it shows the seriousness that we need to put into this one. The Honorable Minister of Local Government says intensified cleaning. So when they say that there's going to be cleaning today, Saturday, and tomorrow, Sunday, it's only to rejuvenate the code that's always been there. Keep Zambia clean, green, and health campaign, but rejuvenated. Everyone has to get involved in this particular fight. Now, you could be asking, what to do if you are displaying some symptoms? So according to the health experts, they are saying the biggest red flag or sign is the shortness of breath, followed by a high fever and worsening cough, in which case you should seek immediate medical attention. If you have a history of medical conditions that can decrease your immune system's response, you will want to be extra cautious as well. So decreased immunity may be caused by some of the following conditions: being older than age of 65, diabetes, heart disease, chronic lung disease, chronic kidney disease, cancer, HIV, or taking immunosuppressive medications. Those are some of the things that have been noted to maybe reduce your immunity. So if you could have any of such conditions, there's need to step up to go and see health personnel so that they can assist you and give you much more information. So if you fell into one of those categories and are experiencing any symptoms, you can contact the health personnel. And remember, in Zambia, the toll-free line is 909 toll-free line. Let's take a break.
Coronavirus, what you need to know.
What is it?
It is a pneumonia-like infection, possibly originated in animals and spread to humans. It causes illness ranging from the common cold to more severe diseases.
How does it spread?
It is transmitted from human to human and is airborne. It spreads through respiratory droplets when an infected person coughs or sneezes.
How can I protect myself and others?
Wash hands thoroughly with soap and water or an alcohol-based hand rub. Cover nose and mouth when coughing and sneezing. Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching eyes, nose, and mouth. Cook meat and eggs thoroughly. Avoid unprotected contact with live, wild, or farm animals. Avoid non-essential travel, especially if you have a fever or cough.
What are the signs and symptoms?
Fever, a headache, coughs, sneezing, shortness of breath, sore throat, chest pains, rapid heartbeat, breathing difficulty. In severe cases, it also causes pneumonia and even death.
What should I do if I think I am infected?
If you present any of the above symptoms, seek medical care and share previous travel history with medical personnel. For further information, contact the Ministry of Health 0211253040 up to 5 or the Zambia National Public Health Institute 0211269432 0964638726 09744935553 or 0953898941.
Lero tikumbula tiboni zona.
Ntawo samba kumanja kulibe.
Hygienic Spanish.
imwe dzimukudyaso samba kumanja para chain malpractice
apa nomba diarrhea yala mixta assault pamala.
That's why mfuko sambira na hygienic soap of Safapi.
Go please, madam.
Go and hygienics and Kurkutave.
Hygienic soap with active silver technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
All right, so there's need for us to observe high hygienic practices there in the country, not only now, but if we can only inculcate these into our children also, so that even beyond we can be able to live clean. Remember, 2018, we were badly hit by the cholera outbreak. Hygiene standards were raised by all of us, and now we even need to double up those efforts to make sure that we control this pandemic. So as we speak in the country, on record, 2 cases. These some of the updates we expect to address these issues today, because we didn't have the update yesterday. So the nation wants to find out how are the 2 doing. The minister, the last update he gave, the 2 are asymptomatic. The children this morning we got from the Zambia National Public Health Institute Director, Professor Mukonka, who mentioned that the children have been released but still under quarantine from home to be observed further. But the 2 who are asymptomatic, what's the state of affairs? That's what we're looking forward to the minister to include in his update today. Not to forget also that we intensify cleanups in markets. Not only that, we also want to be very wary of where are we going, how many people are in there, and members of our family to have at least a soap or a sanitizer, hand sanitizer, to sanitize everyone that's coming in. Avoid handshakes. Take as much warm fluids as you can as the day goes on. That way, we keep our immunity active and a little warm. So we need to take all those precautions. We are going to be engaging Chileshe Kangwa anytime soon, so that we can be able to catch up on what is happening there in readiness for her and the entire team to be in the team. But remember, the figures we're looking at are quite alarming still. Over 10,000 have been killed by the deadly coronavirus. Over 250,000 of the world's population infected. And these figures are not stuck. They could be going up or reduced depending on the circumstances. And 4 countries have recorded deaths of over 1,000. China, one of them, Italy, Iran is also there. So these are some of the dynamics that are coming into play. We know that the President of the United States of America, Donald Trump, took a test for coronavirus, to which he tested negative. So if you feel like you came into contact with somebody that has a history of having traveled, especially from high-risk countries, you want to be on high alert and just avail yourself to the health authorities so they can have you checked. At the local front, from the newsroom we got there, the Vice President is calling on stakeholders to get involved and just rise to the occasion and be able to assist in a way that can help us to hype up the awareness also. We have border points that we share with other countries. We do have the Victoria Falls border post in Livingstone between Zimbabwe and Zambia. We spoke to Angela Limonya, our reporter, a little earlier in the week, who was there to show that citizens who are crossing the border between Zambia and Zimbabwe are well aware the reasons why they are being screened. The international airports, Harry Mwanga Nkumbula Airport in Livingstone is on high alert. The Simon Kapwepwe Hotel International Airport on the Copperbelt Province, the KKI, Kenneth Kaunda International Airport here in Lusaka, also on high alert. All those that are disembarking are having to be scrutinized by the health personnel. Elsewhere, we know that those that are coming into the country through international buses that are ferrying people from South Africa, for example, on business trips, from Tanzania, there's a docking area, a docking port along Kafue Road where all the buses are having to go and embark their passengers from there. And then health personnel, the Lusaka City Council Acting Public Health Director, Edgar Mwanda, a little earlier, mentioned that the Lusaka City Council Public Health team is already there. They disinfected, sanitized the whole area, and they make sure that they spray the bus after people disembark. All these are efforts to mitigate on the impact and also to halt the spread of coronavirus at a local level. The Minister of Health has mentioned that the country shouldn't be doubted. All systems are in place to help contain this virus from spreading in the country. So stay with us. Anytime, we are certainly going to cross over there when the ministers do settle down. ZNBC TV1 is already ready for us to get to give you all that happens from there. Let's now take a break as we get much more facts and just to do some replays of exactly what coronavirus COVID-19 is about.
Coronavirus, what you need to know.
What is it?
It is a pneumonia-like infection, possibly originated in animals and spread to humans. It causes illness ranging from the common cold to more severe diseases.
How does it spread?
It is transmitted from human to human and is airborne. It spreads through respiratory droplets when an infected person coughs or sneezes.
How can I protect myself and others?
Wash hands thoroughly with soap and water or an alcohol-based hand rub. Cover nose and mouth when coughing and sneezing. Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching eyes, nose, and mouth. Cook meat and eggs thoroughly. Avoid unprotected contact with live, wild, or farm animals. Avoid non-essential travel, especially if you have a fever or cough.
What are the signs and symptoms?
Fever, a headache, coughs, sneezing, shortness of breath, sore throat, chest pains, rapid heartbeat, breathing difficulty. In severe cases, it also causes pneumonia and even death.
What should I do if I think I am infected?
If you present any of the above symptoms, seek medical care and share previous travel history with medical personnel. For further information, contact the Ministry of Health 0211253040 up to 5 or the Zambia National Public Health Institute 0211269432 0964638726 09744935553 or 0953898941.
Lero tikumbula T-bone zone.
Ntawo yosamba kumanja kulibe.
Hygienic Spanish.
imwe dzikukudyasa samba kumanja vada chain malpractice
apa nombata iliya yala mixta assault pamala.
That's why mfuniko sambira na hygienic soap of Sapompi.
Go please, madam.
Go and hygienics and kurukuta them.
Hygienic soap with active silver technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
ZNBC TV1, thank you so much for staying with us, and do still stay with us because we will be getting to Ndeke House anytime when the ministers are settled to give us an update for today regarding the COVID-19 virus. In Zambia, 2 cases are on record, and we expect to get an update regarding how they are doing. Now, the last update attracted 8 ministers in that auditorium. Amongst them were Minister of Home Affairs Stephen Kampyongo, Minister of Information Broadcasting Services Dora Slayer, we had Minister of Commerce Christopher Yaloma, Minister of Chiefs and Traditional Affairs Lawrence Sicharwe, Minister of Transport Mutotwe Kafwaya, Local Government Dr. Charles Banda, and we obviously know that a lot are going to be there today. The economic impact of this virus is severe. China, we know, is one of the biggest trading partners with Zambia. And when we speak of China halting, for example, producing certain merchandise, we could say, if it stops exporting or importing, then the economy of the entire world, the economy of Zambia is affected. For example, we can talk about the copper prices on the London Stock Exchange now gets to go a little down. Prices plummets because China is not importing more of the copper from Zambia. Just to speak a little more about this one, here's our reporter Penelope Sikazwe as she gives us this report on the economic impact of the COVID-19.
China's economic troubles have gotten the attention of other countries, including Zambia. This is in the wake of the deadly coronavirus in that country, which has affected its business with other countries. Economists are looking at the impact should the situation in China remain the same.
China is one of the biggest consumers of our copper. And with what is happening there, I'm sure that the construction industry in there has slowed down. production activities have slumped, and in the long run, if the disease is not contained or the virus is not contained, there are chances that it will affect the demand for copper, and therefore we could see a slump on the international market in terms of the price of copper.
Another economist, Dr. Luvinda Habazoka, had this to say.
When you have China's appetite to produce goods going down, find that they stop consuming raw materials, and it means that they don't import your copper and other raw materials that they import from Zambia. I think that for small-scale businesses, and this is the time for Zambian producers that have substitute products to be on top of things and produce for small businesses. I think we need to enhance import substitution.
The ripple effects are being felt at small-scale business level as well. This man used to make frequent travels to China to feed his growing customer base. I spoke to him at length about his biggest worries.
No, it has affected not just me, it has affected a lot of people. Why am I saying this? Because a lot of product which we have here is coming from China.
He says he has to think twice about travel to keep safe.
I'm one of the people who bought a ticket. I bought it in January. Okay, I was supposed to go on February 10. But when that issue started, it was very difficult for us to go there.
Some businesswomen say they have had to consider getting goods from South Africa to satisfy their clients. Penelope Sikazwe, ZNBC News, Lusaka.
The world's second largest economy, China, and its impact on Zambia. And as you can see, the COVID-19 has affected the economy. Small business men and women who travel to China to go and order clothing, shoes, have now halted their travels. It's because of the COVID-19. And China has stopped also getting things, for example, copper from Zambia because of what is currently going on around the world. We can only hope that the situation improves very soon so that we can get back to normal business. Away from there, the Minister of Chiefs and Traditional Affairs, Lawrence Sichalwe, being part of the briefing on Wednesday, on Thursday, he mentioned that their Royal Highnesses in Zambia, totaling to up to 288 traditional leaders that we have in the country, have been involved. They've been engaged to help sensitize their, within their chiefdoms, to sensitize their members, and they are having to play a role. And so far, that has been noted. And obviously, this is what could have made the Barose Royal Establishment (BRE) to hold the Kwamboka traditional ceremony, which was due to be held on the 4th of April, 2020. Speaking of which, that message being taken into by their Royal Highnesses, we do have Her Royal Highness from Ikelenge here, a report by Victor Mwila, where she was calling for the members of that community in there to practice high hygienic levels to halt the spread of COVID-19.
To observe government measures aimed at preventing and controlling the coronavirus. She has commended government for efforts that have been put in place to stop COVID-19.
Ina kuosha chain kuda kwetu akama market akama shop munu mumpata ya miye kiring kanda muikarana kasekesha kumwekaranga na kumpinjidi ejima wanyi hadi muntu uduwejima hachitamba chindi chinga shuhumbeket yakwira ne muntu na kwenzana kwata hana hamafu atachika weru kumakasi na soap kulonda ina kwata hana hamafu muronga chona kutia nawe yeni musongo nukumari wona kuyinyirira.
In collaboration with health authorities, the local administration in Ikelenge has held a stakeholders meeting to ensure that key measures in preventing and controlling COVID-19 are adhered to. Ikelenge District Health Director Dr. Mark Chilombe has guided the meeting on priority areas requiring concerted effort from stakeholders.
Because Ikelenge is a border town, we called on our stakeholders so that we may set up measures that will help us prevent person-to-person transmission in an event that we had an outbreak of COVID-19.
The district administration is happy with the demonstration of commitment from stakeholders to support government efforts.
we are pleased that among the members who had representatives from other stakeholders who came and participated with us, and they showed willingness to help government in terms of resources and support.
Ikelenge district lies at the tail end of northwestern province, bordering Angola and the Democratic Republic of the Congo. District preparedness and response to the coronavirus is therefore key. Victor Mwila for Zanis in Ikelenge, northwestern province.
That's Victor all the way from Ikelenge. They are giving a perspective of how the rural places also are responding. It doesn't leave out any place. All spaces around the world are affected, and even in the country, the far-flung areas of the Republic of Zambia are equally affected, because some people could be getting out of Lusaka, getting to travel there, or from other urban areas at provincial level. Now, we know that it's a weekend, Saturday and Sunday. A lot of football activities are held around the world, but we've seen that major football leagues of the world have been suspended until further notice. Some of them, the English Premier League is one of them. The Spanish La Liga has been altered. Italian Serie A. They tried to play some games behind closed doors, but then again, authorities advised to say those are humans who are coming from homes. So it really doesn't help in any way. And so most of these major leagues were halted. South African League is the same because the game of football involves contact. People will be getting into close contact with each other. So those needs, there was a call that they be suspended for now. In Zambia, we are aware the ABSA Cup has been put on hold, and so the games will probably be played at some other time as the year gets to unfold. The Euro 2020 also has been affected, not to forget the CHAN tournament also in Africa has also been affected. The only thing that still stands as one of the big or the major sports events for the year 2020 is the Tokyo Olympics in Japan. For now, it still stands. The Prime Minister of Japan said, Shinzo Abe says, this is still as planned. It will go on as planned. But as things unfold, we will see how the situation builds around the Olympics 2020. It would be an exciting moment for all of us, especially Zambians, because we know our girls, the Copper Queens, have qualified. They've made history. They are going to be playing at the Tokyo Olympics 2020 for the first time in the history of women football in the country. That is an achievement. The country wants to follow proceedings from that end. But only then we can only keep our fingers crossed that the COVID-19 doesn't get to continue spreading as it has spread in recent past. We can only hope that the cases continue to begin to dwindle down so that that event can be held as scheduled. But that's if the World Health Organization deems it fit to proceed. We'll keep an eye on it. A lot of events, we are keeping an eye on them. So stay with us so that you can catch up with what is happening latest regarding COVID-19 at global as well as local front. We are going to take yet another break. If Chileshe Kangwa is ready at Ndeke House, we will be getting to her so that we can hear exactly what is obtaining on the ground regarding the expected briefing by the Minister of Health and other ministers anytime soon. So don't you go away. You can follow ZNBC TV via Facebook simply by liking our Facebook page, ZNBC Today. Just in case you are off TV, you can still continue monitoring online. Stay with us.
Coronavirus, what you need to know.
What is it?
It is a pneumonia-like infection, possibly originated in animals and spread to humans. It causes illness ranging from the common cold to more severe diseases.
How does it spread?
It is transmitted from human to human and is airborne. It spreads through respiratory droplets when an infected person coughs or sneezes.
How can I protect myself and others?
Wash hands thoroughly with soap and water or an alcohol-based hand rub. Cover nose and mouth when coughing and sneezing. Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching eyes, nose, and mouth. Cook meat and eggs thoroughly. Avoid unprotected contact with live, wild, or farm animals. Avoid non-essential travel, especially if you have a fever or cough.
What are the signs and symptoms?
Fever, a headache, coughs, sneezing, shortness of breath, sore throat, chest pains, rapid heartbeat, breathing difficulty. In severe cases, it also causes pneumonia and even death.
What should I do if I think I am infected?
If you present any of the above symptoms, seek medical care and share previous travel history with medical personnel. For further information, contact the Ministry of Health 0211253040 up to 5 or the Zambia National Public Health Institute 0211269432 0964638726 09744935553 or 0953898941.
Lero tikumbula tiboni zona.
Mtaulo samba kumanja kulibe.
Hygienic Spanish.
imwe dzikukudyasa samba kumanja para chain malpractice
apa nombata iliya yala mixta assault pamala.
That's why mfuniko sambira na hygienic soap of Sapompi.
Please, madam.
Go and hygienics and kurukuta them.
Hygienic soap with active silver technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
Maintain high levels of hygiene. Let's take you to Chile Shekangwa at Ndeke House to just give us the position now regarding how soon we could be expecting the ministers to settle down and to get that official briefing on COVID-19. Chileshe, what's the current position there? Okay, we'll be getting to her in just a tiny bit. Stay with us. Like I mentioned, you can follow ZMBC online by liking our Facebook page, ZMBC Today. You can get the live feed from there in case you are not following on TV. So you can follow what is happening, regarding the scenario. At country level and internationally, the minister begins to break down the records as they are from an international level, from a global perspective, and bringing it down to Zambia. So we expect that to happen anytime soon. But our team is at Ndeke House, where as and when they are ready, they will be getting to us so that we can be able to get what is happening. So schools have been closed officially. All learning institutions, in short, universities, colleges, we are talking about primary schools, secondary schools, kindergarten, all of them have closed. Children back home, and at home they are being told to play a role to sensitize everyone in the family so that we can do the right thing. Away from there, reduced hours of church. If church service takes more than 1 hour, the Minister of National Guidance and Religious Affairs, Godfrey Sumaili, mentioned that has to be broken down into less than an hour, or better still, alternatively, the best is to meet in smaller groups at various locations, at homes, and only get the program of how that worship can go. There was a call that the whole nation gets to pray from respective family arrangements for this particular COVID-19. So those are some of the measures that are being put in place. So economically, the whole world has really been pinched by COVID-19. So now let's take you to Chileshe Kangwa at Ndeke House. Chileshe, please update the nation. What is happening now?
Thank you, Sam, and we are still awaiting the address from the Minister of Health, Dr. Chitalu Chilufya, and we do ask our viewers to stay tuned as we get to hear an update on the COVID-19 or coronavirus, as everyone is calling it. So we will be here, and you will be crossing to us live a little bit later as we get that update. But for now, we go to our normal programming.
Okay, so we'll be getting there. Well, it's a big undertaking that requires a lot of pieces to put together before announcement gets to happen. So don't go away. Stay with us. We will be right back anytime soon to cross back there so that we can get the official briefing for today. I'm Samuel Machishi, and Obed Mambo still keeps me company. We will be together in just a tiny bit. Stay with us.
Coronavirus, what you need to know.
What is it?
It is a pneumonia-like infection, possibly originated in animals and spread to humans. It causes illness ranging from the common cold to more severe diseases.
How does it spread?
It is transmitted from human to human and is airborne. It spreads through respiratory droplets when an infected person coughs or sneezes.
How can I protect myself and others?
Wash hands thoroughly with soap and water or an alcohol-based hand rub. Cover nose and mouth when coughing and sneezing. Avoid close contact with anyone with cold or flu-like symptoms. Avoid touching eyes, nose, and mouth. Cook meat and eggs thoroughly. Avoid unprotected contact with live, wild, or farm animals. Avoid non-essential travel, especially if you have a fever or cough.
What are the signs and symptoms?
Fever, a headache, coughs, sneezing, shortness of breath, sore throat, chest pains, rapid heartbeat, breathing difficulty. In severe cases, it also causes pneumonia and even death.
What should I do if I think I am infected?
If you present any of the above symptoms, seek medical care and share previous travel history with medical personnel. For further information, contact the Ministry of Health 0211253040 up to 5 or the Zambia National Public Health Institute 0211269432 0964638726 09744 41.
Hi, I'm Chileshe, and this is ZNBC TV1.
mashani kuvalume venu mwingate mwana navo tinjela yo muko watavachinja nangu vakashi venu venga wa mashani nangu vakashi venga misungero imwe tamugomba kuvakashi venu venga sonkele ng'anda tinjela yo muko watavachinja tinjela yo muko watavachinja we mwana wandi tinjela yo muko watavachinja we mwana wandi tinjela yo muko watavachinja nangu valume venu venga kwata ifyu mashani kuvalume venu mwingate mwana tinjela yo muko watavachinja nangu vakashi venu venga wa mashani nakuba kashibenga misungero imwe tamubonga kuba kashibenu benga sonkere nganda chinjela yo muko watabati chinjela yo muko watabatinja we mwana wandi chinjela yo muko watabatinja chinjela yo muko watabatinja we mwana wandi chinjela yo muko watabatinja chinjela yo muko watabatinja we mwana wandi chinjela yo muko watabatinja chinjela yo muko watabatinja we mwana wandi chinjela yo muko watabatinja
umutembo ufini na konse ikakwa mano iwe
abaumya abawamona baba n'obwapya pamulandu wa chuma icho bakwata palupalwa mwaume pang'anda ulesuka palupalwa mwana kashita pali neryo amana kashi wamona baba n'obwapya pamulandu wa kumisungero tamubomba palupalwa mwaume pang'anda neryo umo palupalwa mwana kashi pang'ando lesunga n'abafyashi bakufyala wabasulila kumo pamulandu wa mukashihobe we mwana wandi nangu wingopo musungu iwe nangu wingopo kumusungu iwe nangu wingopo iwe kateka nangu wingopo kuli kateka aleta binitambi chwemba chalilando mutembo ufini na konse bane tiye ifunkutu lekako shakumwesu kulubemba nemwina lwapula nemwina ntoto Mofia wa ngomba MW Studio ala nikuno kuine mwevu tiye mofia tiye tata tiye mwewa na jaketi lina chitenge tuwalanga bena chipata beshi bachoko tuwaba na ifwe tiye iwe dombwana iwe noti ifyo na iwe tiye balange dombwana balange tiye dombwana tiye maya tiye ala nijwa sina shakulu bemba
One thing I know is that I lived a happy life. Hear me, kakumisa etucheni zonke mochilolele kwaliko chilu mendo waluse. All of this experience, I will use it to give me disposition to teach the youth. I shall be a better man in a...
It is slowly turning into a marvel of the Copperbelt province. The Copperbelt International Airport has so far reached 60% completion. Despite construction works progressing well, the multi-million-dollar project has not been spared from the effects of the COVID-19, which has taken toll in most parts of the world. A site inspection by Special Assistant to the President for Project Implementation and Monitoring, Andrew Chela, revealed that critical equipment and specialized staff are marooned in China due to the COVID-19 outbreak. AVIC International Chief Engineer outlines the effects that the coronavirus has posed on the pace of works.
Completion date, and because of the effect of the coronavirus, right now we don't know when the project is going to be completed. So we're not able to give an exact date. The coronavirus has had a huge impact on the progress of the airport. Two main things that have been affected. One is the equipment that's arriving from Europe and also from China that has been delayed.
Special Assistant to the President for Project Implementation and Monitoring is, however, confident that measures will be put in place to cushion the effects of COVID-19 on the project. The Copperbelt International Airport is expected to service approximately 1 million travelers per annum. Zanis reports in Ndola.
It was a business meeting between NAPSA and ZNBC. NAPSA Director General Yolad Kachinda and ZNBC Director General Malolela Lusambo proceeded to the boardroom accompanied by directors. Key business pronouncements for the benefit of the two institutions were made.
We have planned to spend well over 3 million kwacha on these platforms. We are among the top 5 advertisers on the NBC platforms, and we are glad that we are utilizing our own infrastructure in this regard.
We want to encourage you to continue to utilize our platforms, because I know by virtue of you being a government institution, you have a mandate to undertake, and that mandate speaks to you having also to accurately inform the Zambians on what your products and services are.
Mr. Kachinda, during this meeting, disclosed that the authority has over 16,000 retirees who are receiving monthly pensions for life. Later, the ZNBC Director General led a team from NAPSA to the studios to show them the digital transformation. Acting Director Engineering Brighton Kaka was on hand to explain how the transmission is being done, and Mr. Lusambo did a demonstration of Sunday interview program in the studio where ZNBC controller TV Grevazo Zulu produces it from. The tour ended up in the newsroom where stories for all news bulletins for TV and radio are produced. Patricia Banda, ZNBC News, Lusaka.
Imagine keeping an owl as a pet, something many people would never do because of the superstition associated with this particular bird. But for Claire Mateke, keeping the 35-year-old visually impaired owl named Bunny comes naturally.
This owl was rescued as a baby by Mr. John Stratford, who used to live in Kitwe. So he looked after it for about 16 years in Kitwe. Then he moved to Livingstone. He came with it here. Then he kept it, I think, another 4 years. So in about 2005, he had to leave the country, so he asked me to look after it.
But is this thing that people believe that an owl is a sign of bad omen?
The spotted eagle owl is the most common owl in southern Africa and can live up to 12 years in the wild and 30 years in captivity. Angela Limonya, ZNBC News in Livingstone.
gantunyaga musabata ngalaletwa kulindinywe aba Trade Kings ikusumpula maumi
ngoyu imulaga urwera mbuli bujo mugupa imulaga iwajundu
bawala basune bawotola basune oli wetemba shirira buya muganwa mwabe wa musashe ngombe wambanga minangu oli wetemba musashe
mbaba ibanamola ibakasijja kumirundu isuka busi nkogu kubagali abagayintu gohya bagotoga igwanya bagotoga nkulikombya
mwali bihabuti nomutweberera twamutambula amanzo biro gu programu iwagantunya iga munsabata eryo gumuletera programu mubuziba ibwasono ndime hambaya munangandu nomutweberera ko tipe twamubambira intu hinjanji hande nandene mu programu eswa buziba ibwasono eryo nditaso wajindi atulanganye kwamba oti hena inzi twamuletera mubuziba ibwasono ijagusango nako tipe mulimbo mwigwamba tiwige yainda kwali kusegelera ibuziba bwa bagubushi eryo Charles Mujolo wagalira ntomwe abagubushi omnomdolopo ili alusaga kwalo kubagali kusegelela ibuziba bwabo ko kuti ulatuleta itwambo tonse otu wamana buyo wao ko kuti pe twalanganya ikujatikia ibulwazi iwa COVID-19 antela coronavirus eryo koti ba habu pampu batsandira kwamba kuti hina tukanya kuti igubugwabirira alimu agutusense muna inza yo tukanya igubere hayi kwamba kuti itubulibone kwamba kuti muntu atayambuli ibulwazi obu kwamana wao ko kuti Petra unka igoguya gumwembeshi ko kuti mwangana muzumara wagali nkugo wewe gulanga mbuli inzira hipya halo hikalirira yotukanya gubere hamubona wamba kuti ibulimi ibwasumpuga agamboga gujincha igwa hulantira igujincha igwa luombo lunga koti twalanganya inzira ehi anto mwangana muzumara kwamana bo wao koti Petra njira mujibera ichagulanganya ihisobano ihande nandene omungusango natulanganya kapati ibola ili ya maulu ubona kwamba kuti hena mbubuti mbotukana igusumpula ibola ili ya maulu mujisi Charles Mujolo ulatupa mubandi oyu nomuntu eberera kuti Petu tasowe ajindi alije nino jindi atubone kwamba kuti hena ibagubushi bagabusegerera buti ibuzuba bwabo
obu mbuzwa bwawibaluga agusegerera ibagugushi bonse ibagatula ilubazo mugurene irwanguru irwajisi ya Zambia buzwa obu bwabagugushi bulayibalugwa agusegererwa amwaga mu 12 March igusegerera igwa buzwa obu ingagulatula ilubazo mujisi ya Zambia igutegwa ibagugushi bonse ibagatula ilubazo mugurene irwanguru irwajisi bayibalugwa agulemegwa irwanguru golu jisi ya Zambia jagapigwa mu mwaka wa 1964 mu 24 October 12 March mwaka imbuzo bwagabikwa igumabali jisi ya Zambia alimu anyika yonse mbo yalidwe igutegwa gwaba igupa ibulemo ubagugushi bonse bagatula ilubazo ukweliye imasi mo bazulirwa guti ajuwe igujana rwangologo omuno mudolopo lya Lusaga ibuzwa obu bwagali wibalugwa agusegererwa gujibumbwa jiminina irwangulugo baleri ibajisiba Edgar Lungu mugibaluga agusekerera ibagugushi bonse ibagatula lubazo murene irwanguru rwajisi ibagabika malubaluba ajibumbwa bumbwa jimini na rwangulugo. Mwigulubazo ahalo ihibela himini na ibugwabirizi ibwajisi winde ombasirutu ibabo abalu bagatula ilubazo mugubika malubaluba ajibumbwa bumbwa eji. Bamwe bagabika malubaluba ajibumbwa bumbwa yimini na irwanguru eji ni nkome himini na imasi abo omuno mujisi ja Zambia. Mubuzwa obu wakwibaluga agusegerera ibagugushi ingata wibalugibu agusegerera ibagugushi bagatula ilubazo murene irwanguru irwajisi epesi abagugushi ibapona igwalino ingabalagugu higwa abwambira mbuli hulumeni inzanjala yakubakweli igusumpula ibumi aboponi ibwabo. Gunze abo ibagugushi ingabalagu higwa wamba guti abaloberedi igutula lubazo winda muguberya imanu abo ngubarerego amwamiriza muguzugiriya igusumpula jisi ya Zambia. Igusegera igwamwaga ono wajisi umutwe wamba guti mebo nderedi iguyala inza yagutaliha. Eryo ugusegerera ogo gwanyina agwahana gwa mumanza igute gwajwe higi ugwabira igazunda gaitwa uti coronavirus. Ibantu bagari gwahana winda muguma nabo amakugu alimu awumwetera omwe. Kulombo ya igwa bantu bonse mujisi gwamba guti ibagugushi balajigwa igutula ntamu ya gusumpula ijisi ya Zambia winda mugwela inza handene. Ijitonga jamba guti mapondo atemwa mwahuga eryo nko guti ibamanene bajisi igwende gwaje jino jende berete kuberegera antom abagugushi igute ko baguzo ayuno inga hagujala iri mu manzi abagugushi ino akambuka utinga bagujwe igucan ibusongo winda muberegera antom ankome inga jago paguti abalo bagugushi bagajwe guzudiriya imirimo ya losompugo. Mujitonga twamba guti wakaliregerera wagawa eryo jirandega party guti abalo bagushi bala inzira hinga hakweri igusumpula jisi agusumpula bumi aboponi ibwabo. Guzwite omuno mudoropo ilya Lusaga a report mebo ndime Charles Mujolo.
Twalumba igapati Charles Mujolo ko kuti kutwambo totuletera ogo buzwa kuchibumbwa ija Lwangulo oja tiyayi buzwa imbubagali kusegerera ibagubushi.
simakama yasweka nyeleti tunolwana siyandiko kwatwambula hubeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwambula hubeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simakama yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola siyandiko kwatwa simagamba yasweka nyeleti tunolwana siyandiko kwatwa mulahumeno twalyana kizi unondigaba siyandiko kwatwa simabende najiga muso ya unyopola sela sela no majembele sela sela no majembele sela 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 no majembele yani unitotera kuzitete yani wasa kamba yani uwatu wasimabende naku wasimagamba alimu yani uwatu wamulahumene ene mwambazi nedoli ene mwajiswa nemu yembetemu ega simigabake iwatu watulia kumjera harusana ega simiga kumapata eria muliro mazizi jamuye
lino atunke goguya ante atubamu bandi ante omwe abamune nangu ba Dr. kalangwa koti batwambire ikujatikia ibulwazi ibwa coronavirus kutina mbulwazi nzi ali mu mbubutimbo tukoya ibubu kwabirira ibulwazi obubwalo ibwanyonganya buponi agati gamasi ande nandene nyiga yonse mboibede no kwamba ati mwijisi ya Zambia tabunanjira
nojundu ibwali no twanda ikulanganya imubandi ujatikia igazunda gaitwa kuti coronavirus gazunda aga nobuleya gandirira amujinga ja Africa amana alimu aumasi agubuguwa gazunda agatarikira oguya kugisi ya China inkoko twabona kwamba atarikira guya kuyandirira igisi cha Zambia ya in the hand and ne ogwabira igazunda agaitwa kuti coronavirus wamba kuti katanjiri omno mugisi ya Zambia mboti bandike abaloba habu pump guzwida igumutabi ulanganya nseba abana malaya mba Dr. Kalangwa ino kataninga agudiba mubantu oyo atwanganya mbuli bantu bakoguya kwa shamiri maguna mpundwe wamba kuti hena igazunda agaga coronavirus bagahimbuti twambo totu tonse twagaleta mwangala muzumara
nomuntu webelela kwabola igazunda igabuga igapati igategwa coronavirus abobo igazunda aga twanda kuhiba iwamba kuti hena ibantu ibakokuno kumunzu utegwa kwa shamirimo bahinzi agazunda aga kalokalwana igapati imasi manjanje ikubikiriya amasi azulirwa mujinga ja Africa mbulijisi ja South Africa alimu amwe masi atuzungurukide arwanwa agazunda aga igategwa coronavirus atunghwelino kubantu bakokuno ibakwa shamirimo kwamba kuti hena chinzi chobahi agazunda igategwa coronavirus
twaka inyumfamwe wakanyumfa ilaza ayibuli kukora nsomana kumanza mwaswa kutoyeti mwasamba
no muri gwabirira buti bukomutabe agazunda
winda mugulya agusamba
coronavirus twakanyumfa nkalongolo anunganda jamba byani kalongolo kaenda na mumuo na mbunda kachinyumfa imi